Hey everyone, so welcome to part 7 of this anesthesia series. Now we'll be starting with cylinders. So, so in cylinders we have different types of cylinders. So if you see a cylinder which is completely gray in color, then it is of carbon dioxide. If it is completely blue in color, it is N2O. If it has black body with white shoulder, it is oxygen. If you see furthermore division, this is black and this is white, and it is air. Now we have this and this. So this is pin index safety system, and this will be diameter index safety system. So in this we'll have oxygen pipe in white color, and we'll have blue color pipeline for N2O, and black color pipeline will be present for air, and yellow pipeline will be present for vacuum. So just remember these are these things. Now this cylinder colors will be this. So gray entirely is carbon dioxide, blue entirely is N2O. Then we have this only shoulder will be in white, which is for oxygen, and this will be black, this will be gray, this will be for air. Now pin will lock only if it is fitted with the correct cylinder. Now coming to each cylinder, so oxygen, N2O, air, then carbon dioxide, and N2O plus O2. This is Entonox. Nothing but Entonox. Now we'll be dealing with their pin numbers, indexes. So for oxygen, just remember it is 2. So it is 2, 5. Here we have three letters or whatever you can remember. So it is 3, 5. And air is first priority, so 1, 5. Then carbon dioxide, just forget about it for few minutes. This will be 7, it is like highest thing. And carbon dioxide is 1, 6, 2, 6. So this is how you can remember them. So 1, 6 means greater than 7.5%. This is less than 7.5%. So this is how it is. So for 1 and 6 it is near wall, and 2 and 5 it is between walls, it won't touch the wall. So 2 and 5, and 3 and 5 are little close, so there will be nearer dots, and this is how it looks for different cylinders. And remember there are 2 more cylinders, orange and brown. So orange for cyclopropane 36, and helium plus oxygen 70%, 21%, which can lead to airway obstruction. So this is about the cylinders, and this is for pipelines, and internal pressure can be seen. So this is how you remember the cylinders and all. So now we will be talking about important topic, that is inhalational anesthetics. So in inhalational anesthetics we have desflurane, Then we have halothane, we have isoflurane and sevoflurane. So sevoflurane is usually yellow in color and iso is in purple color, and halothane and desflurane. Desflurane will be in sky blue color. Then halothane will be red in color. So this is how they are color coded. Now coming to next thing, that is desflurane. So basically desflurane is Tech 6 vaporizer, and it is used in patients with renal diseases and people who are obese. So it is best for those people. It is also used as maintenance agent. It is used as maintenance agent. So it is irritant actually, and is not used for induction for this reason. And CO with soda lime, that is desiccated, will be coming out. So this is main choice for the maintenance agent. Now coming to next part, that is halothane. So halothane has minimum MAC. So by this you can say it is used for max bronchodilation, and it can be used in autoimmune hepatitis. It is used, it causes max ICP rise. Also arrhythmias are seen. So this is a side effect. So it has to be avoided in heart condition as it sensitizes hearts to epinephrine. Now coming to isoflurane, simple point, it is used for cardiac surgery. However, there is one controversial point, like whether it causes coronary steal. So this is doubtful, but therefore it is drug of choice for cardiac surgeries. Now coming to sevoflurane. So this is compound A. It has fruity odor. It is used in liver diseases, daycare, then asthma as induction agent, and it is used in children. So this is a very good anesthetic agent, that is inhalational one. Now it is used in liver disease, children, daycare, asthma, induction. So one side effect we see here is it is nephrotoxic. So these are few inhalational anesthetics that are very important. Now we'll talk about their blood gas solubility and MAC. So starting with same order, desflurane, we have halothane, then we have isoflurane, sevoflurane, and one more thing we are going to discuss here is methoxyflurane. So MAC, minimum alveolar concentration and blood gas solubility. So desflurane, so we'll be seeing this desflurane is MAC 6, then we have halothane 0.75, isoflurane 1, sevoflurane 2, and methoxyflurane 0.2. So what you have to remember here is actually you can remember it much more easier like in this order. So hist. So this is how you can remember mhist. So you will be remembering these numbers like 0.2, 0.75, 1, 2, 6, and you have N2O as well, which is 104. So 0.2, 0.75, 1, 2, 6, 104, and blood gas solubility is actually proportional to 1 by speed. This is proportional to 1 by potency. Now here you will have 12, 2.5, 1, 0.65, 0.45 and 0.47. So these are all similar and these three will be similar. So this is how you can remember easily. So this is least potent and this is most potent because this is not used because of its nephrotoxic property, and solubility will be more for xenon. So this will be the fastest, but it is therefore expensive or costly, so it is not commonly used. So these are the properties. Now we will talk about some more properties. Now we'll be talking about N2O properties. So N2O, this gas, it shows second gas effect. So it will be emptying the alveoli so that another gas will come and fill the alveoli. So this is second gas effect, and then it has concentration effect. It has diffusion hypoxia. It also has B12 deficiency causing property. So these are four properties that N2O has: second gas effect, concentration effect, and diffusion hypoxia and B12 deficiency. So it is therefore contraindicated in closed cavities, like middle ear surgery and intestinal obstruction. So it is contraindicated in this both. Now coming to few more properties of anesthetic agents. So inhalational agents, then we have IV agents. So we'll be talking about IV agents later, but all inhalational agents are basically uncouplers. Means they'll be decreasing heart rate, serious things will be decreased, then they will decrease respiratory drive, they will decrease cerebral oxygen. Only thing they will increase is ICP or cerebral blood flow, so this is increased. Now coming to IV agents, so they will be, so one exception here you have to remember is ketamine. So ketamine doesn't obey all these things. So heart rate will be decreased, serious stuff will be decreased, then respiratory drive is decreased, and cerebral metabolic oxygen will also decrease. However, cerebral blood flow and ICP will also decrease. So this is one point which you have to compare between these two. So this is all about anesthesia, inhalational anesthetics. Now and next we'll be talking about IV anesthetic agents. Thank you.